To optimize effectiveness and tolerability, oral drugs used for the treatment of neurological conditions need to reach their site of action. While this process begins with absorption of the drug from the gastrointestinal tract, the oral route of administration requires a consideration of factors that affect drug bioavailability, such as absorption from the gastrointestinal lumen, transit times within a region-specific absorption site, potential for saturable absorption mechanisms, and presence or absence of food. Conventional gabapentin is thought to be absorbed via a low-capacity transporter located only in the upper small intestine. This pathway may become saturated, limiting the amount of drug that reaches the systemic circulation, resulting in high interpatient variability for absorption. This may result in variable drug exposure and a necessity for multiple daily dosing. Horizant transported prodrug technology takes an active drug with saturable absorption and conjugates a molecule to drug that results in a transported prodrug that is recognized by high-capacity transporter proteins that occur naturally throughout the gastrointestinal tract, including the small intestine and colon, to gain more efficient drug absorption. As a prodrug, it is converted by endogenous enzymes to the active drug as it is transported from the gastrointestinal tract into the circulation. Horizant, an extended-release formulation of gabapentin enacarbil, utilizes this transported prodrug technology. When Horizant tablets transit through the gastrointestinal tract, gabapentin enacarbil is slowly released from an extended-release tablet formulation and is transported and enzymatically cleaved in the enterocytes to produce gabapentin, which enters the circulation. Horizant results in dose-proportional extended release of gabapentin in the blood and low interpatient variability in drug exposure. These pharmacokinetic characteristics of Horizant help increase the potential for gabapentin to reach its site of action in the treatment of neurological conditions.
Important safety information for Horizant gabapentin enacarbil extended-release tablets. Indications. Horizant gabapentin enacarbil extended-release tablets are indicated for the treatment of moderate to severe primary restless leg syndrome, RLS, in adults. Horizant is not recommended for patients who are required to sleep during the daytime and remain awake at night. Horizant gabapentin enacarbil extended-release tablets are indicated for the management of post-herpetic neuralgia, PHN, in adults. Important safety information, warnings and precautions. Effects on driving. Horizant may cause significant driving impairment. The duration of driving impairment after starting therapy is unknown. Patients should not drive until they have enough experience on Horizant to know if it impairs their driving. Patients' ability to assess their driving competence and degree of somnolence caused by Horizant can be imperfect. Somnolence, sedation, and dizziness. Horizant causes somnolence, sedation, and dizziness. Patients should not drive or operate other complex machinery until they have enough experience on Horizant to know if it impairs their ability to perform these tasks. Lack of interchangeability with gabapentin. Horizant is not interchangeable with other gabapentin products because of differing pharmacokinetic profiles. The same dose of Horizant results in different plasma concentrations of gabapentin relative to other gabapentin products. The safety and effectiveness of Horizant in patients with epilepsy have not been studied. Suicidal behavior and ideation. Horizant is a prodrug of gabapentin, an antiepileptic drug, AED. AEDs increase the risk of suicidal thoughts or behavior in patients taking these drugs for any indication. As a prodrug of gabapentin, Horizant also increases this risk. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Anyone considering prescribing Horizant must balance the risk of suicidal thoughts or behavior with the risk of untreated illness. Patients, caregivers, and families should be informed that Horizant increases the risk of suicidal thoughts and behavior and should be advised of the need to be alert for the emergence or worsening of the signs and symptoms of depression any unusual changes in mood or behavior, or the emergence of suicidal thoughts, behavior, or thoughts of self-harm. Behaviors of concern should be reported immediately to healthcare providers. Respiratory depression. There is evidence from case reports, human studies, and animal studies associating gabapentin with serious life-threatening or fatal respiratory depression when co-administered with central nervous system CNS depressants, including opioids, or in the setting of underlying respiratory impairment. When the decision is made to co-prescribe Horizant with another CNS depressant, particularly an opioid, or to prescribe Horizant to patients with underlying respiratory impairment, monitor patients for symptoms of respiratory depression and sedation, and consider initiating Horizant at a low dose. The management of respiratory depression may include close observation, supportive measures, and reduction or withdrawal of CNS depressants, including Horizant. Drug reaction with eosinophilia and systemic symptoms, DRESS, multi-organ hypersensitivity. Drug reaction with eosinophilia and systemic symptoms, DRESS, also known as multi-organ hypersensitivity, has been reported in patients taking antiepileptic drugs, including gabapentin. Horizant is a prodrug of gabapentin. Some of these events have been fatal or life-threatening. DRESS typically, although not exclusively, presents with fever, rash, and/or lymphadenopathy in association with other organ system involvement, such as hepatitis, nephritis, hematological abnormalities, myocarditis, or myositis, sometimes resembling an acute viral infection. Eosinophilia is often present. Because this disorder is variable in its expression, other organ systems not noted here may be involved. It is important to note that early manifestations of hypersensitivity, such as fever or lymphadenopathy, may be present even though rash is not evident. If such signs or symptoms are present, the patient should be evaluated immediately. Horizant should be discontinued if an alternative etiology for the signs or symptoms cannot be established. Discontinuation of Horizant. When discontinuing Horizant, patients with RLS receiving 600 milligrams or less once daily can discontinue the drug without tapering. If the recommended dose is exceeded, the dose should be reduced to 600 milligrams daily for 1 week prior to discontinuation to minimize the potential of withdrawal seizure. In patients with PHN receiving Horizant twice daily, the dose should be reduced to once daily for 1 week prior to discontinuation to minimize the potential of withdrawal seizure. Tumorigenic potential. In an oral carcinogenicity study, gabapentin enacarbil increased the incidence of pancreatic acinar cell adenoma and carcinoma in male and female rats. The clinical significance of this finding is unknown. Adverse reactions. The most common adverse reactions for patients with RLS, incidence greater than 10% and at least 2 times the rate of placebo, were somnolence, sedation, and dizziness. The most common adverse reactions for patients with PHN, incidence greater than 10% and greater than placebo, were dizziness, somnolence, and headache. Drug interactions. Gabapentin enacarbil is released faster from Horizant extended-release tablets in the presence of alcohol. Consumption of alcohol is not recommended when taking Horizant. Horizant taken in conjunction with morphine causes increased somnolence, sedation, dizziness, and nausea. Use in special populations. Pregnancy and lactation. There are no adequate data on the developmental risk associated with the use of Horizant in pregnant women. In non-clinical studies in rats and rabbits, administration of gabapentin enacarbil was developmentally toxic when administered to pregnant animals at doses and gabapentin exposures greater than those used clinically. It is not known whether gabapentin derived from Horizant is secreted in human milk. However, gabapentin is secreted into human milk following oral administration of other gabapentin products. There are no data on the effects of gabapentin on the breastfed infant or the effects on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Horizant and any potential adverse effects on the breastfed infant from Horizant or from the underlying maternal condition. Pediatric use. Safety and effectiveness of Horizant in pediatric patients have not been studied. Geriatric use. Clinical trials of Horizant for the treatment of RLS did not include a sufficient number of patients 65 years and older to determine whether they respond differently from younger individuals. Because elderly patients are more likely to have a decreased renal function, the frequency of dosing may need to be adjusted based on calculated creatinine clearance in these patients. Renal impairment. Gabapentin is known to be almost exclusively excreted by the kidney, and the risk of adverse reactions to this drug may be greater in patients with impaired renal function. The dose of Horizant should be adjusted in patients with renal impairment based upon creatinine clearance. Horizant is not recommended for treatment of RLS in patients receiving hemodialysis. You are encouraged to report side effects of prescription drugs to Arbor Pharmaceuticals LLC Medical Information at 1-866-516-4950 or to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. For additional safety information, consult the Horizant full prescribing information at www.horizont.com. This site is intended for U.S. residents only. Horizant is a registered trademark of Arbor Pharmaceuticals, LLC.